Medicaid provides health care coverage to people whose income, health, or age qualifies them for it. Medicaid is funded by the federal and state governments, but the states administer it. The federal government pays a percentage of Medicaid expenditures, which varies by state. Children in families whose income is less than the federal poverty level are eligible for Medicaid coverage through the Children's Health Insurance Program, CHIP. Some states provide this service to families whose income is higher than the federal poverty level. A state cannot base eligibility on a lower threshold. Those who are blind, disabled, or at least age 65 are eligible for Medicaid if their income and financial resources qualify. Medicaid is especially helpful to elderly people because the cost of long-term nursing home care and catastrophic illness can exhaust their Medicare benefits and personal savings. Medicaid eligibility. While federal regulations impose minimum eligibility standards for Medicaid benefits, each state sets its own requirements for eligibility and administers the program. Each state determines the services that Medicaid covers in the state. Eligibility for Medicaid is based on financial need. Although most Medicaid funds are spent on the elderly, they also help other qualifying individuals. Key point: states determine Medicaid eligibility based on an applicant's disability or age, at least 65 years. Income limitations. Asset limitations. While each state sets its own rules for Medicaid eligibility, all provide coverage for children in families earning less than the federal poverty level, eligible for CHIP. Pregnant women with family incomes below a certain federal level. People who are blind or disabled with income below a certain federal level. People who are at least age 65 and whose income and financial resources are below their state's qualifying limit. The Affordable Care Act makes adults under the age of 65 whose income is below a specified federal level eligible for Medicaid services in all states. Applicants for Medicaid must disclose all assets and sources of income. The formulas used and the types of assets considered for qualification vary by state. The state also sets a maximum limit on the income that a qualified applicant may have. If an applicant's assets exceed certain limits, the applicant must deplete them before becoming eligible. This is referred to as spending down. The limits and the types of income and assets counted also vary if the applicant has a spouse who needs support. The concept of spending down is especially significant with respect to long-term care. Even those with moderate financial means may find it impossible to pay for necessary long-term care without turning to Medicaid, but qualifying for it requires that they spend down a significant amount of their assets. This need to spend down can be avoided by having a long-term care insurance policy. Medicaid benefits. Each state decides which services Medicaid will cover. For Medicare beneficiaries who are eligible for their state's Medicaid program, Medicaid is the secondary insurer. Medicare is the primary insurer. Depending on the state, Medicaid may cover the following. Please pause the audio and review the table. For your review, Medicaid is funded by the federal and state governments, but it is administered by the states. Although the federal government sets the minimum qualifications for Medicaid eligibility, each state determines its own scope of Medicaid coverage. Children in families whose income is less than the federal poverty level are eligible for Medicaid coverage through the Children's Health Insurance Program, CHIP. Persons who are blind, disabled, or at least 65 years old are eligible for Medicaid if they meet income and financial resource requirements. Persons who exceed the Medicaid limits for financial assets may need to spend down these assets to qualify for Medicaid benefits. Medicare is a primary insurer. Medicaid is a secondary insurer.
Okay, here are the quiz questions. This is a short and sweet one. What is the principal purpose of Medicaid? To provide health care and health-related services to people with low incomes, to uninsurable people, to establish a state-run health agency, to provide low-cost alternative to private health care insurance companies. All right, I'm going to guess the last one. The statement describes the importance of Medicaid. It's is limited to those who can't get Medicare coverage. Medicaid assistance is principally spent on long-term care for the elderly, and it's to provide health care coverage for senior citizens. For elderly Medicare recipients, Medicaid reduces the financial burden of long-term care, nursing home, and catastrophic illness. When a person applies for Medicaid, the limits and the types of income and assets counted vary dependent upon whether the applicant is at least 65 old. When determining eligibility for Medicaid, states do not consider household size. All right, let's see how we did on this one. I got 2 correct. First one was a not. The principal purpose of Medicaid is to provide health care and health-related services to people with low incomes. Okay. All right. The importance of Medicaid is to reduce the financial burden of long-term nursing care and catastrophic illness. When a person applies for Medicaid, the limits and the types of income and assets counted varied upon whether the applicant has a spouse who needs support. Okay. When determining eligibility for Medicaid, states do not consider the household size. Okay, it's based upon disability, age, income limitations, and asset limitations. So that's it on this chapter. I'll see you on the next one.